Welcome back, dear viewers. Our second guest of the evening is د.أنس العيدان, a specialist in internal medicine. Good evening, Dr. Anas.
Good evening, nice to meet you.
It's really a pleasure to have you with us tonight on Hello Kuwait.
And you as well. Thank you for having me.
Thank you so much. So let's talk more about the subject of arthritis. If you please tell us what types of arthritis are there and what are the differences between the types of arthritis and the witness symptoms or the symptoms we can track.
All right, okay. So arthritis simply means inflammation of the joint. Any joint can be affected in the body. Exactly. Mainly the joints that are involved are the small joints of the hands, the knees, the hips. So literally any joint can be involved, and simply it refers to inflammation of the joints. Now when we say joint, there are lots of structures that make the joint, including cartilage and linings and so on. Types of arthritis, which is an inflammation of the joints, we have two types, inflammatory and non-inflammatory arthritis. So the pathological manifestation and the pathological causes of these types of arthritis is a bit different. However, all of them tends to cause pain and swelling and sometimes redness around the joints, and these are the two main categories really of arthritis, as we call inflammatory, where it is usually caused by inflammatory disorders like rheumatoid arthritis, lupus, or other autoimmune diseases, or other types that may be due to trauma or osteoarthritis. As we tend to age, we develop loss of the cartilage surrounding the bones in the joints. Yeah,
definitely, doctor. You mentioned some types and things related to arthritis, but the most common type of arthritis is the osteoarthritis. So what are the risk factors of it exactly?
All right, so in our area, in the Gulf in general and all around the world, this is very common disease that we encounter in our practice, and usually it is managed either by the family physician. Sometimes if it is difficult to be treated, he may refer the patient to a rheumatologist in the hospital. Now, osteoarthritis is a disease where we tend to lose the cartilage as we age in weight-bearing joints. So the most common joints that are involved are the knees and the hips, sometimes the hands as well, where we develop small swellings around the small joints of the hands, in which there is a swelling or a lump that comes, we call it the hibidin or Bouchard nodules. And this is caused by the loss of the cartilage, the hyaline cartilage that surrounds the bones on those specific joints. And when there is a crack, so the nerves are being exposed and the patient develop pain, in which we tend to recommend certain types of treatment modalities to control the symptoms.
Since you mentioned the details of the osteoarthritis, doctor, will you please mention to us the treatment, because everyone's watching now, they got they are having the attention about the symptoms and things like this. Now they want the treatment.
All right, so with regard to treatment, of course, education and lifestyle changes is very crucial in managing osteoarthritis.
That's great.
So weight reduction, all studies showed that weight reduction improves the symptoms of osteoarthritis, and we always recommend people who suffer from the disease, especially in the weight-bearing joints like the knees, to reduce their weight as much as they can to lessen the pressure on the joints. These are one of the non-pharmacological treatment of osteoarthritis. There are other modalities like exercise. It is very important, and it is not true that when you have osteoarthritis and you use your joint quite a lot not to exercise. On the contrary, then you have to exercise and strengthen the muscles around your joint. Now, coming to the pharmacological treatment of osteoarthritis,
Yes,
before we used to prescribe simple painkillers like acetaminophen, but the guidelines has changed, and at the moment, in addition to education, we give patients non-steroidal anti-inflammatory drugs if education and lifestyle changes did not improve the symptoms. However, there are certain contraindication and risks of these type of medication, like ibuprofen and namely Olfen or other types that we are all familiar with. And then we use another type of treatment which is called duloxetine or capsaicin. So these are the pharmacological treatment that we may use. If those treatments are not effective, the last resort, of course, is surgery, where we tend for a joint replacement, and it is usually done by the orthopedic surgeons.
Yeah.
Yeah.
So osteoarthritis, as you mentioned, Dr. Anas, you mentioned the risks and the pharmacological treatment also, but you mentioned also exercising, and I'm sure now dear viewers who are suffering from osteoarthritis, they want to know from you the types of exercises that helps them with their osteoarthritis difficulties or problems.
Yes, definitely. So exercising is very important in this disease, and the non-impact exercises, so walking, sometimes cycling, these type of light exercises where you don't tend to put pressure on your joints, however strengthening the muscles around the joint. The rehabilitations, we have a good number of physiatrists who are doctors specializing in physiotherapy, not the physiotherapist, the one who actually doing the physiotherapy, but the physiatrist, who's a doctor who can prescribe certain type of exercises and exercise maneuvers of each joint, how to improve the symptoms and to lessen the pain, strengthening the muscles around the joints. So I believe walking is very important, so we encourage most of our patients to take like a long walk when they do have osteoarthritis. Swimming is well a good exercise to do.
Dr. Anas, you mentioned exercising, and you know we have really wonderful cuisine in Kuwait, like we have different type of food and we cannot resist food, and you mentioned losing weight and you mentioned also exercising, so it's a change of lifestyle. And let's talk specifically about Kuwait here. So is there, how does, or like let's say, how does the patient's surrounding environment affects them? Is there any effects because of the environment, the type of food, things around you? Sometimes bad friends, let's say,
yes.
Bad advices.
Yeah, so of course, like in any other subject, any bad influence around the environment would have an impact on health in general. So smoking, having friends smoking and smoke with them, eating more than we need, gaining weight, of course, putting pressures on the joints and so on, eating a lot of sugary and really oily and fatty food is in general not good for the health, not only for osteoarthritis. So of course it does have an impact on the health in general, and we always advise people about education, health education, health promotion, disease prevention, and certain type of exercises depending on the symptom and the joint that is involved in osteoarthritis.
Yeah, well said, Dr. Anas. Thank you so much for the valuable information you're giving for us tonight. Do you have any last word for our dear audience?
Is just to maintain a good health and try to eat healthy food, avoid bad health behaviors such as smoking, including the vibes, and maintain their health as much as they can.
And bad friends and bad influence.
And bad influence.
Definitely.
Indeed.
د.أنس العيدان, it was really a pleasure to have you with us tonight on Hello Kuwait, and hopefully see you soon and wish you the best of luck with your future endeavors, D.أنس.
Thank you very much. Thank you very much indeed for having me.
Dear viewers, we just had with us D.أنس العيدان, specialist in internal medicine.